So today's video, I'm going to get into the fact that there's going to be a Medicare debt bomb to the middle class. Now, why do I take this seriously? Because this is my class of people, the middle class. This is where most of my clients are. And this is where the majority of people are going to end up spending more money in the future for things like Medicare, and their social security checks are going down. So let me jump into this real quick. So the reason for this video is I want to explain to people that when they're on these Medicare Advantage plans, they're asking me, how could this possibly be $0 for the premium? How can this be nothing? I just get this for free and all is well. I get dental, vision, and hearing, gym memberships, vitamins, and toothpaste at the store for free, all these different things. I'm going to explain why. The number one reason is a lot of people don't know this, and I have to explain it to people, that the government gives out subsidies for the Medicare Advantage plans. And from this article and many articles that I've read, they give about $1,000 a month to the Medicare Advantage plan for having people on the plan. Now, let's take a look at this. This article states payments to Medicare Advantage plans boosted Medicare spending by $7 billion in 2019. Now, if you see, this article is August 17th, 2021. So they have to dive back into the data, but the data shows it's getting worse. It's not getting better. So $7 billion in 2019, it's probably $9 or $10 billion for 2022. Now, the federal government spends $321 more per person for beneficiaries enrolled in Medicare Advantage plans. What I want to explain to people is the government cannot handle Medicare. They do not know what they're doing. Basically, what happens is they have these meetings and they show these charts like, oh, this is what, such and such people had to spend, and this is what these other people that didn't have any money had to spend. We need to give money to Medicaid. We need to give money to Medicare. And these think tank people, basically our Congress people, make decisions and they have no idea what's actually going on in the real world. But what's really going on, if you look down here, it says the higher payments, for Medicare Advantage, $11,844 per person versus $11,524 for traditional Medicare. But here's the real kicker. So they're spending all of this money on Medicare Advantage. And when the real things kick in, meaning the hospital, the cancer patients, the skilled nursing, this is where you, the people of the middle class, get burned for payments. So when you get into these plans, a lot of times you're getting all these benefits. You're like, I don't understand why this is so good. Now, I'm not saying that all the Medicare Advantage plans are bad. There's actually good companies out there that have good plans. But there's a lot of red tape that people do not understand. A lot of people say, I know you can't get something for nothing, which is absolutely true. One of the things that I see constantly, people call me and I'll say, what's your maximum out of pocket for that? And they will say the maximum out of pocket is, let's just say $3,500. Now, I had videos where I showed the majority of them are $6,700, $7,500, $8,300 max out of pocket that you're going to have to pay if you go into the hospital and so forth multiple times during the year, or if you have a major crisis or a disease or something that you come down with. Let's say cancer, heart attacks, strokes. If you have something like this, you are going to end up paying a lot out of pocket, and then you will be stuck in one of those plans, most likely. But if they're paying $11,844 per person versus the Medicare supplements, original Medicare, or just original Medicare, $11,500, the cost is going to come back on you. And this is the problem. We have not seen the debt bomb yet. It is coming. I think it will I think 2024 is when it's really going to happen. This is when you're going to start seeing Medicare Advantage premiums shoot up, because as inflation runs wild, the $1,000 that they give to these plans is not going to be worth as much as it was a year ago, 2 years ago. As we know, we all saw the housing market. Houses went up $100,000 in 1 year. Why was that? Because we printed $7 trillion. So how many billions of dollars do we have to print for Medicare and Medicaid before that starts happening with the premiums? Just like your housing price went up, the premiums will start rising. This is inevitable. I have thought this for years. I remember in 2016, I thought this was going to happen back then. But of course, because of 2008, I thought 8 years, have gone by where we printed all this money, but it kept going. And this is what's really scary about now is now over 50% of the population is on these Medicare Advantage plans. And I get the phone calls, as well as some of the other people that do these videos, get the phone calls from people that say, I didn't realize this about the plan. I actually got a phone call from one person who said the agency, he said the agency, not one specific agent, told him he had to get a Medicare Advantage plan first. He could not get on a Gap plan. I had to tell him that's a flat out lie. That's not true for anybody unless they got out of their initial enrollment period, which he was not out of his initial enrollment period. So this is what happens. I've seen videos from other people talk about commissions for $700 in these Medicare Advantage plans. Absolutely. People think that some people are pushing these Gap plans because the commission is higher than the Advantage plans. It's absolutely the opposite. So it is not about pushing people into the Gap plans because of commission. It is about, I have never seen anyone on a G plan complain about the benefits. I've been doing this for over 15 years, and I have never seen a complaint about this. Another thing is I get calls from doctors across the country. These are people that see bills, talk to nurses, talk to their billing staff. They all get the same plan, the Plan G. Now, I get it. I talked to one person about that, and I mentioned the doctor thing, and they said, yes, well, that's because they're rich. Look, if you look at some of the prices that I have gone over, even if you're thinking about a Medicare Advantage plan, I've gone over this chart before. Now, the Advantage plans, you get zero premium, and then it could be $250, it could be $350 a day in the hospital. If you look at hospital coverage, if you look at doctor coverage, you have to look at what the specialist cost. What, is it $35 each specialist? Then you have to look at CAT scans and how much that costs out of pocket. So I'll just cover this up right here. Skilled nursing. People, you only get 20 days of skilled nursing with most Medicare Advantage plans. It's not a lot of time for somebody that's in there. And I have seen $295 a day for skilled nursing. So you're in there 3 days. Boom, that's your whole premium for some of the Gap plans for the whole year. So I've talked to people where I've said, listen, what's your maximum out of pocket? I have put in here $75.50. A lot of middle class people will not get on these plans where the maximum out of pocket is $35.50 or something like that, $3,600. The reason being is because when they dig into the plans, they realize the benefits are not that great. So they know they're getting what they pay for. It might be an HMO, they want a PPO, they want to travel outside of the state. You have to look at the fact that your doctor does not even have to take a PPO. The PPO plans will tell you, oh, if you're outside of the network, you just have to pay a little bit more. Well, number one, the max out of pocket won't be this. It'll be another cost most likely. So it could be $10,000 max out of pocket if you're outside of the network. And then number two, the doctor does not have to accept the plan. He can say, no, I don't take that. And then you can't go there. So you have to watch. Just thinking that you're going to go outside the network is not good enough. Now, I have always said this. I talk about Plan G because it's the most comprehensive. I talk about Plan N because it's very affordable for most people. And there's just a couple of benefits missing from what the Plan G. But if you are turning 65, I cannot stress this enough. Do not get on a Medicare Advantage plan if you can afford the certain prices of the Gap plans. And this plan, high deductible G, is in competition with the Medicare Advantage plans, in my opinion, because if you look at the premium, $40 as opposed to $0. Most people, especially the middle class, can afford $40 a month. And what this gives you is the same benefits as the G plan, except for a high deductible of $2,700 a year. Now, with this deductible, if you see right here, Medicare still pays its 80% and you will pay your 20% up to $2,700. So I have here, if you look at this, hospital, you'll pay nothing. I mean, you'll pay that 20%, but you're not going to get a $15,000 bill or a $10,000 bill like you will with some of these Medicare Advantage plans. You will not. You will get a $2,700, but you would have to be in there multiple times, most likely. And then skilled nursing, 100 days. Same thing. If you were to max this out, This is the maximum payment you would make, $3,804. But let's say you didn't max it out. Let's say you were healthy, you just wanted catastrophic coverage. This would be, your premium would be $480 for the year. And then on top of that, let's say you spent $1,000. Well, $2,700 compared to $1,000, it's basically just $480 plus $1,000. So you'll add this down to, let's do, it'll be $1,480 obviously. So $1,480 would be your max out of pocket. Now, like I said, what if this max out of pocket here is $7,550, or what if it's even $3,600? Doctors can turn you down. That is the problem. Some people think there's some plans out there that say, oh, you can go anywhere you want and the max out of pocket is the same. Yeah, but the doctors might not accept it. What if you end up with some kind of, let's say you have a stroke and you want to go to specific places, or you want your loved one, your husband, your wife, whatever it may be, to go to a specific place. If they don't accept the Advantage plan, you're going to be in a world of hurt. And this is why I say, no matter what, when you're first getting on Medicare, in my opinion, at least get this high deductible G plan, if not the G, which is the best, most comprehensive plan, or the N plan. I always tell people, I only tell them about 3 different plans: G, N, and high deductible G. Thanks for watching this video. If you need my help, please call my office, and I'll see you at the next video.